Okay, let's talk about behavioral therapy. Behavioral therapy is incredibly popular. It is welcomed by insurance companies because it is measurable and observable. So insurance companies like to pay for behavior therapy because therapists can give them data to show that their clients are actually making progress versus like psychodynamic therapy where you could describe that your client has had an insight, but you don't necessarily know if that translated to better emotional experience or change in behavior. So behavior therapy, it's really good to know about this. It's the principles that you might know about from training your dog, but very few people are as consistent as they need to be, even with their dogs, even when they know they should be. And it's really helpful when you're a parent. You need to know about behavior therapy when you're a parent so you understand how to give consequences to your children's behavior so you get the behaviors out of them that you want. Okay, so as you're looking at this definition, behavior therapy is the systematic application of the principles of learning to treat psychological disorders. Now, I want to emphasize systematic application. You know, when you get a new puppy and you're trying to train it not to jump up on you or people, and you say off or down, and you put your hand out and all of that, and then you reward the puppy for not jumping up. Well, that's fine until a family member goes, come here, Fido, and pats their chest and wants the dog to jump up on them. That is not a systematic application of the principles of learning. Now the dog is confused. And the dog will learn to discriminate between people it can jump on and people it can't jump on. But when it's a puppy, you've really made a problematic situation for the dog by letting it jump up on one person. Okay, so systematic desensitization. We're going to do a demonstration of this. That is a behavior therapy involved in overcoming phobias by exposing the person progressively to more fearful stimuli while one remains deeply relaxed. Let me tell you right now, if you're ever asked, oh, maybe even in this class, what disorder can we treat most successfully? I will tell you, it's phobia. We have this protocol, systematic desensitization for phobia, and we can almost guarantee that we can get a person over a phobia. So if you have one now, or develop one in the future, or know someone who is somewhat compromised by their phobia, I promise you they should know that that is our most successful treatment modality. Okay, and gradual exposure, that's a behavior therapy technique for overcoming fears through direct exposure to increasingly fearful stimuli. Okay, so let's do some. What do you fear? Write 12 levels of that feared object or experience from lowest to highest. And I'm going to give you an example of bridge phobia because I worked with someone who had bridge phobia. The lowest level for him was hearing the word bridge, then thinking about bridges, learning of a trip he needs to take over a bridge, the morning of the trip and checking the weather for wind, leaving the house, getting halfway to the bridge, getting close to the toll booth, seeing the toll booth, passing the toll booth. Now, if you happen to have bridge phobia, just talking about these things is probably giving you anxiety. And I promise we have a way for you to get over it. You can go see our counselors here at MJC. Then starting onto the bridge and then approaching the top of the expanse, the highest point of the bridge, and then being at the top of the expanse of the bridge. After that, on the way down, he would feel better and better and better until he got off onto the land. Now, what was interesting about this was he wasn't worried about whether the bridge had water under it or just land under it. He wasn't really worried about driving off the bridge. He didn't even really have any visualization or imagery about problems he could have with a bridge. He was just fundamentally terrorized about being on a bridge. Okay, so you should pause the video right now. Think of something that really bothers you. Maybe it's public speaking, giving a speech in your speech class here at MJC. Maybe it's going out on a date so you don't ask anyone out. Maybe it's dental work, right? Oops, I didn't mean to hit that. So I want you to come up with 12 things that bother you about this thing that gives you tension, and then I will show you what we will do. Okay, so pause the video. Okay, so now that you have your 12 things, here's how we do systematic desensitization. Let's just break these words down a little bit. Desensitization means to desensitize one to things that are triggers for anxiety. And systematic desensitization is to go about it with the lowest level triggers up to the highest level triggers. So the other component of this is training is combined with these steps, and we'll do progressive muscle relaxation in class. I'll show you what that's like. But the emphasis on it is focused on relaxed breathing, letting your abdominal area rise and fall as you inhale and exhale. And then you systematically address the muscle groups, allowing them to tense and then relax and focus on the difference between the feelings. And a best practice here, which was what I would do, is using biofeedback equipment to determine the level of relaxation. So an electromyogram might put some electrodes across the person's forehead, or an EEG might be measuring their brain waves, or galvanic skin response might be measuring the amount of electrical activity in their skin. Your GSR goes up high when you're nervous because all of your pores in your skin release a little bit of water, and then of course underarms, etc., release a lot of water. So these are components of a lie detector test too, so we can tell when you're tense, we can tell when you're relaxed. So we would combine those steps with the ability to relax, and there's the list. Master the relaxation response. Step 3, pair relaxation with each step progressing from low to high anxiety provocation. Step 4, as much as possible, experience each step while staying relaxed. So the bridge guy, at first we went through all of those steps while he was relaxed in the office until he could even imagine being at the apex of a bridge while staying relaxed. And then he needed to go do those steps, not when he was required to go over the bridge to the Bay Area for his work, but just go as far as he could go while maintaining good breathing and relaxation. And then he would have to come back home. And he would have to go through it the next day. And as he repeated that, he was desensitizing himself. Okay, so we'll talk more about that in class. Another behavior therapy is modeling. So it helps an individual acquire a target behavior by observing a therapist or other individual demonstrate the behavior and then imitating it. This is the best way to teach someone a behavior, watching someone else do it. Another behavioral therapy is token economy, and this is where you have a behavioral treatment program in which a controlled environment is constructed such that people are reinforced for desired behaviors by receiving tokens that may be exchanged for desired rewards. So a classic example of this is working with students who are on the autism spectrum, and you figure out that they will work for certain things. So each time they do a behavior, like they look at the person in the eyes or they say the word they're being prompted to do, they get a little token, maybe a poker chip or something, and then they can add those up and they can go to a little toy area and exchange them for small toys. So B.F. Skinner's probably the most famous behaviorist, and his idea was that all of our economy should be token economy, where we exchange good behaviors for tokens that we can then use to buy items. That would increase our good behavior, according to him, and then we would be living in a utopian environment. Okay, so behavior modification, all of you have heard of. I hope some of you do this with kids and can demonstrate it in class. I'll be asking for those of you who work with kids in treatment programs where you do direct instruction. So behavior modification is a systematic approach to applying rewards for desired behavior. We focus on the stimulus, the trigger for the behavior, the response, and then the consequence that the person receives for that behavior. So if the stimulus is Valentine's Day and your boyfriend or girlfriend or husband or wife's response is giving you something that you like, then their consequence of giving that to you is going to be you express love and adoration for them, you kiss them, you give them, all kinds of affirming messages that they are great, and you really reinforce that they got you something cool or made you something or said something great on Valentine's Day, for example. Okay, so there's the ABA technique. A means let's take a baseline. So now let's say a kid is tantruming. The baseline, we see how many tantrums the kid does per day, per week, per month. Then we put in a treatment where they are rewarded when they're not tantruming and they are ignored or their behavior is negatively consequated when they are tantruming. And then we stop and just go back to the original situation with no treatment and we see if the tantruming has gone down. Hopefully it has. If it hasn't gone to the level we need it though, we go back to baseline, treatment, back to baseline. The ABA is put into place, and hopefully by the time we get back to the normal situation here, 2 sessions of treatment have ensured that the kid is not going to be tantruming anymore. And I know I'm going through this quickly. When we demonstrate it in class, it'll make even more sense. Okay, so you guys can get jobs in behavior therapy. And I'm going to ask who works with an autism spectrum treatment program in our class. These various programs will train you to do behavior modification. Again, a super important skill. And they work around your work schedule. It's great for a future career in psychology or being a parent or even a manager of people to understand how to give positive reinforcement, rewards, and how to consequate behavior when you get what you want and you don't get what you want. So you can become a board certified behavior analyst, they're called BCBAs, with a BA in psychology. It's a 15-unit concentrated program where you learn how to do behavior analysis. And there are companies in Modesto such as BEST, Central Valley Autism Project, the Kindle School, and more, where you can do this job right now. You wouldn't be board certified, but you'd be supervised by a BCBA that sets up the program with the child, and then you would work with them through one of these programs. You would either work with them when they are brought to the center, or you would go to their home and work with them. Like I said, they work around your schedule, they pay you while they're training you, and the pay is decent. So if you're interested in knowing more about that and working in that field, I would highly recommend it. Okay, I'm going to stop there and move into humanistic therapy next.